Okay, guys, how's it going? Studio is a mess, and I'm going to talk about something that's not necessarily related to men of values, but it's something we should all be taking a look at. Dr. Med Vendor needs to get fired. Now, when I say that, that means in my interactions lately with doctors, they want to diagnose and treat. And the quickest thing they want to do is hand out medication, whether it's for anxiety, whether it's for depression, whether it's for high cholesterol, whether it's for high blood sugar. They want to dispense meds. They want to see you for 7 minutes. You wait for a half hour. They want to dispense meds. They'll diagnose. They'll take your blood levels for a physical. They'll take a look at those levels and say, okay, well, your creatinine is high. It's way too high. You must have liver problems. But they don't look at the possible causes. Like if you look at my chart, I've been bodybuilding since I was 18. I'm 48. Do the math on that. So my body weight is I'm 5'8". My body weight is heavy for 5'8". I'm morbidly obese, and that's what one doctor said at a physical. You're morbidly obese because your weight versus your height. I'm looking at, okay, woman doctor, pretty attractive, but saddlebags huge. Now, I'm not body shaming or anything, but it's like, wait a second. You're carrying a lot of body fat. I'm carrying a lot of muscle. So if we both step on the scale and give our height, input our height, I'm morbidly obese, but whatever. So we'll talk about the physical. When I went in for physical in 2016, said I had high cholesterol. Well, creatinine. I'm going back and forth because I'm getting passionate and excited about this. Creatinine, if you take too much creatine, there's a byproduct that comes out in your blood, creatinine, from creatine. It spills over if you have excess of creatine. So rather than ask me, say, oh, you've been bodybuilding for 30 years, do you take creatine monohydrate, which is nutrition? It's not drugs, it's nutrition. Instead of asking me that, they're like, oh, okay, we got to check your liver, and then switch my blood pressure medication to one that's less hepotoxic, affecting the liver. It's like, wait a second, you didn't ask me that question. I go home and I research this. I'm like, what the? Dr. Med Vendor needs to get fired. Okay, and then, so we'll go on to high cholesterol. I was put on statins, which if you research statins, that's a money grab by Big Pharma, and the side effects will keep you in the hospital. If you have cancer, statins reduce cholesterol because they say it'll reduce the chance of a cardiac event, a heart attack, stroke, whatever, because you have less cholesterol that clogs up your veins and arteries, or more so your arteries. Okay, so everything I've learned since then, I took statins for a little bit, and then I did research. You have muscle aches, you're lethargic, it causes brain fog, all stuff I didn't want to deal with. And to be honest, I took it for maybe a week, and then I decided the side effects are worse than, if I have a heart attack, boom, whatever, and it's a cardiac event that takes me out of the game, at least I don't have muscle aches and all this other bullshit. Quality of life, right? That's what they call it. Keep your quality of life, or maintain, or do whatever you can to enhance your quality of life. The side effects from statins were so big from the studies. We'll get into the studies in a minute. And the benefits were this big. They're tiny. They're tiny as far as reducing the chance of death from a cardiac event. Anyways. But I was prescribed those, and then I talked to my dad, and he said simvastatin works for him. So I'm thinking genetically, I can avoid the muscle pains and everything because my father's doing well with it, right? So I go to get simvastatin from Walgreens, and the price tag before insurance was like $3.98 for 90 tablets, right? Okay, so I've been on TRT for many years now. And I have resources outside of Walgreens and CVS. So I looked into my resources, and I found I could get Indian generic simvastatin for $62 plus shipping. Shipping's expensive if you're sourcing from a distant place. Anyways, so I looked at that markup because what Walgreens gave me was an Indian generic from India. I mean, they're parallel when it comes to maybe they have less standards to meet, but high quality pharmaceuticals. But that's what Walgreens gave me was an Indian generic, right? For $400 is what they charged insurance. Okay, so if I can get it without insurance for $62, I'm like, who's making all this money, right? And then you look at the studies saying that statins are necessary to reduce cardiac events. Well, they're funded by Big Pharma, right? Or there might be an independent study that they'll use that got grants from Big Pharma, which is the same thing as funding. But if you look at it, they took the progress or the benefit by taking statins and put it under a microscope and blew it up. So it looks like you have, I don't know, 36% reduction in the chance of a cardiac event. Now, it doesn't say that you're going to die, but a cardiac event. But if you look at it, it's 0.03 or 0.04 benefit by taking statins. But then if you look at the side effects that happen with being lethargic, it'll put you in a type 2 diabetes like that. I mean, not like that. But if you have cancer and you have low cholesterol, to fight the cancer, statins are working against you. And when I tested for high cholesterol, I was taking in a lot of eggs, but they say dietary doesn't affect it, hereditary does, right? But I do think dietary has an influence. Either way, when I tested high for cholesterol, when they put me on statins, they didn't ask any questions like, did you have a knee surgery, a big surgery, or have you been sick? Because cholesterol is the Band-Aid for the body, right? It helps heal, and that's why it fights cancer, right? It helps you fight cancer. It doesn't cure it. But I had knee surgery. I had my ACL replacement on my left knee, right? So cholesterol would have been high. There would have been an acute boost in cholesterol, right, from that. Didn't ask any questions, just put me on statins because that makes, I mean, if you look at $63, if I order, and when I order 90-day supply of statins from a generic from India for $63, somebody's still making money, right? But Walgreens wants to charge insurance $399 for the same shit. Not the same brand, but a generic from India. So who's motivated to just put you on statins without asking questions? All the studies come from Big Pharma that say that you're going to benefit from it. And doctors, Dr. Medvender, that's why I'm going to title this video because it makes sense to me. Dr. Medvender is maybe getting a kickback. Who knows? I don't know. I don't know the underworkings of how Big Pharma relates to physicians. But that's just one example. Then we go into blood pressure, right? I was put on blood pressure medication. I'm 48 years old. I'm very athletic. Been lifting since I was 18. Done jiu-jitsu. And if with the knee surgeries and everything, I still go for walks. I find a way to be active. And I try to eat to not put on body fat, to keep lean mass and build muscle, which means I eat shitty sometimes and I'll drink beer or something like that. You know, I'm not completely healthy, but I'm much healthier than most Americans at my age bracket. But they said I had high blood pressure. So, okay. I took the meds with me and I figure, you know, that's something that's hereditary in my family. So I figure, okay, I'll take these. I started with a half a tablet to see if that worked. And I had a blood pressure monitor and I took that. Well, I did two things because I was curious. Nicotine jacks up your blood pressure. Now, maybe it's a cigarette, maybe it's nicotine gum, which I'm chewing right now. You know, I should quit that. Or chew, whatever you choose for your nicotine boost. It causes an acute response as far as your blood pressure, right? And it was discovered because I went to the dentist early in the morning. I was chewing nicotine gum. You're supposed to bite it and let it sit there. I was chewing like that. So after researching and using my blood pressure monitor, I abstained from nicotine gum for quite a while. I think it was 36 hours. Then I took my blood pressure every 20 minutes since the moment I woke up. And then I had some nicotine gum. I had half a 4 milligram nicotine gum piece of nicotine gum. And there was a little jump soon after, but I think it was like 10 minutes after, where it was like, oh my God, right? And stress also influences it too. And here's a funny thing. I was calm. I wasn't taking nicotine gum, and I was clocking every 20 minutes what my blood pressure was. Then I talked to my girlfriend at the time. Had an argument, right? This is actually hilarious because, I kept joking with her. I said, woman, you're killing me. Like most people, it's, kind of whatever. But the fact is that arguing with her technically is, right? Because I have a notebook upstairs with all the numbers. But for the 4 hours prior to the conversation, I clocked my blood pressure and it was pretty decent without the medication. Had a conversation with her and we started arguing. And I think it was like 5 minutes into the argument, and I told her what I was doing. I said, I've been checking my blood pressure and trying to do this to understand things. And I said, hold on. I had her on video chat. I'm like, hold on. Watch this. Put it on. My blood pressure was way higher. And I'm not blaming it on the girlfriend, not saying having relationships are bad for blood pressure, but stress is bad for blood pressure. And the doctor didn't ask me. Nicotine gum was on my chart, that I'm an ex-smoker, that I take nicotine gum. But how is your stress level? Do you exercise? I think that was known, but they don't ask questions. They diagnose and treat, and that's what their obligation is. And it's fair to say that, diagnose and treat. But they are not giving you health care. They're not giving you health care because they don't look at outside influences that cause an acute boost or reduction in your healthy blood levels, right? They don't look at that. What they want to do is treat you because that's how they get paid. Diagnose and treat. If they don't diagnose, I don't even think they can charge your insurance company because it's a mystery. And then they hand you off to the specialist, and the specialist doesn't know anything. So then they hand you off to somebody else, and they make a bunch of money off insurance by not diagnosing you. I don't know how all that works. But the idea for me, Dr. Med Vendor should be fired, is because they don't look at the things in your lifestyle that can cause an acute spike or reduction in your blood levels that are indicators of bad health. It's ridiculous. So initially in 2016, when I was diagnosed with high cholesterol, like I said, I took the statins for a week, and I cut back on the eggs, and I kept my exercise, and I got further away from the date of surgery, so I healed up, right? And then the next physical, my cholesterol was just fine. And high cholesterol is not a cause for cardiac events. Inflammation causes plaque buildup. Now, cholesterol goes through your arteries to heal. Like I said, it's the Band-Aid in your body that fixes you, heals you, fights cancer, does all this cool stuff, right? And that's why after you have a surgery or a sickness, your cholesterol is high, because cholesterol is trying to get in your bloodstream and start fixing problems. Right? So statins reduce cholesterol under the guise that it's going to keep you from having a cardiac event or reduce your chances of having a cardiac event, right? So everything that I've read, a decent amount of cholesterol is a good thing. HDL, LDL, whatever. Your total cholesterol should be decent. And if you reduce it, that's where you have more negative health impacts. If you have too low a cholesterol, you can have more problems. Same thing they said with testosterone. If you have too low a testosterone, you're going to have more health problems. If you have too high a testosterone, you're going to have health problems too. That's another metric that you need to monitor, especially for men as you get older. And for women, it's estrogen and testosterone. So you need to pay attention to those markers. Otherwise, if your hormones are off, Dr. Med Vendor is going to prescribe you anti-anxiety, anti-depression meds because your hormones are off. So they're not trying to get to the core problem, right? They're just trying to diagnose, come up with an excuse for the reason that your markers are off, and then give you a medication for it. And Big Pharma is happy about that. So they encourage that behavior through studies or through rewards or through kickbacks. I don't know. I'm not saying that's truth. I don't know for sure, but I'm skeptical. I think so. So Dr. Medvender is not taking our health into concern, our general health. They say that you should look at doctors' results based off of outcomes. So that's a holistic approach to healthcare. It's not just, okay, you got high cholesterol or high blood pressure, here's a med for it. It's like, what are the other contributing factors that might be affecting this person's health, right? Dr. Med Vendor don't give a crap about that. They're like, okay, I get it. I will prescribe this for you, and it'll reduce or elevate the markers that we're looking at, right? But that's not healthy, right? And it could be easy fix as far as just stop chewing nicotine gum, get a little more exercise. And I understand, just like personal trainers out there, most people don't want to take responsibility for their own health, whether it's like, oh, I want to lose fat, but I don't want to eat less or eat healthier foods. So I understand the doctor's approach to that, but it should be discussed. And it should be more than a 7-minute visit. If we're really doing healthcare and not just dispensing drugs, those are things that we need to discuss, but I don't think they're getting discussed enough. And that's the problem. So I've had limited interactions with doctors for physicals, for my surgeries, for all this other stuff. But when I get a physical and the markers come off skewed or out of range, immediately there's a drug waiting for me. Then I go home and I research and I'm like, okay, wait a second. There's factors that cause an acute disruption from the norm of those markers that they're looking at, right? And I know I'm responsible for that. Can I fix that? Yes. Does that mean now that I can leave the medication? I know plenty of people that were sedentary, then they started jujitsu, and their physicals came back glowing. They're getting exercise, stress relief. There's plenty of other things that help out the markers from jiu-jitsu. So being active is a huge thing. And I tell you what, when you do jiu-jitsu, you want to eat better because you want to be able to last long. When you're grappling with somebody, you don't want to get taken out because you're fatigued. So you eat better. So everything under jiu-jitsu helps your markers. Instead of saying, okay, here's statins and blood pressure medication, it's like, hey, man, why don't you try jiu-jitsu and stop fighting with your girlfriend? Right? I mean, there's so many other things that we could look at, and nutrition is a huge factor that could benefit a lot of people. I mean, if you look at vitamin D with vitamin K2, MK4, and MK7, MK7 being the most important one, take that with vitamin D and take a 1 gram vitamin C tablet, 2-3 times a day. Your health overall is just going to go through the roof. If you're unhealthy to begin with. Start some exercise, take those vitamins. Nutrition should be the first step before drugs. Because if you research it, if you take too much of a certain vitamin, it can be toxic, right? But if you're healthy enough, you're going to flush it out and have a chance to do some research to find out you're taking too much. But vitamin D is a big one. That got a lot of people through COVID, and vitamin D causes calcium deposits. So that's why you have the vitamin K2, MK4, and MK7, MK7 being the most important. But they're so quick to just hand out drugs. That's why I'm saying Dr. Med Vendor should get fired. That means if you go to a physical and they don't ask personal questions like, do you take creatine monohydrate? Have you been extra stressed lately? Do you use nicotine products outside of smoking? Because if you smoke, they're going to know about it. They can smell it on you, right? So many factors that they don't ask you questions about because it's not about healthcare. It's about vending drugs. It's about diagnosing and treating and then moving on to the next patient. 7 minutes, I think, is the average what they give you when you go for a physical or a doctor visit. With a cold, it might be different, especially with COVID, they have more concerns. But the whole idea, guys, we got to take this into our own hands. I mean, go see your doctor, listen to what they have to say, but do some research. Don't just accept it. Like we're talking about sheep lately, right? If you just follow what your news media feeds you, you're a sheep. If you follow what your doctor feeds you, you're a sheep. So we have to take it upon ourselves to delve into it, do a little research. The internet has a bunch of misleading research. So it's most important is you get versed on tuning up your bullshit filter, right? I mean, to be able to watch 30 seconds of a dating advice video, 30 seconds of men of values, just watch these videos and turn up your bullshit detector, right? filter through it, and there's research papers out there. And of course, if you see a research paper that you find intriguing, it's important to find out where the source funding comes from. Because if it was big pharma, or if dating advice was funded by divorce attorneys, do you want to take that advice? No, you don't. That'd be absolutely ridiculous. So you got to look at the source of the funding for any studies that you want to take to heart and use for your own personal advice. But I'm saying what the doctors are doing, they're just dispensing medication, and that pisses me off because that's not healthcare. That's trying to get your markers in line, but there's other factors that come into play. I'm going to stop talking about this stuff so much, but man, I'm long-winded, aren't I? I'm just concerned with people's health. Like I said, I'm 48 and I'm paying much more attention to that now. And young guys, I did a video on this earlier that getting your testosterone checked is a huge factor because low testosterone could make you feel depressed. In stressful situations, you could have enhanced anxiety. If you have too much testosterone, you can have enhanced anxiety too. But if Dr. Medvender wants to put you on antidepressant meds, women need to take a look at this too, because apparently there's a lot of women that are on antidepressant meds and anxiety. So guys, before you look at that, I said in the other video, get your hormones checked first so you can see where you're at, because that could be an easy fix. And then you can thrive instead of just being not depressed anymore. You can have that go-getter attitude and all that shit. Anyways, Dr. Medvender that wants to vend out meds to call it healthcare needs to get fired. It's not going to happen. It's a great title for a video, right? Great title for a video, but I just want you guys to be in tuned. Get this shit in your scope, because if you just follow what the doctors are saying, I want to talk to my family about statins. I'm like, oh my God, do you realize the impact, the negative impact statins have on your health and the minimal return that you get from taking statins? There's simple lifestyle fixes that will put you well above what statins are going to benefit you for as far as cardiac events. But that's not talked about because that's healthcare. It's not drug dealing. Let's take the insurance company for all we can. In fact, with my knee surgery, they gave me a knee brace. And they said, here, sign this paper, because if your insurance doesn't cover it, then you're responsible for it. I said, well, how much is it? They said, $320. It's I got a sportier version from Dick's Sporting Goods. I won't mention the name brand, but it was pretty much the same thing, but looked cooler for $79, right? So they're charging the insurance company more, which drives up our rates, which is a bunch of bullshit. But that's the thing. All we got to do, guys, ladies and gentlemen, is pay attention. Don't just take doctor's word for gospel. Like that's the true, and respect them like Jesus. My doctor is a god. No. Here's the thing. IT. If you have a career in IT, you have to consistently be re-educated on the new thing, the next best thing, so you know how to handle it. Doctors, they get their degree, move into healthcare, and I'm sure the smart ones, the ones that are on their game, want to stay up to speed on things. But it doesn't mean all of them do. So they might be operating off of data from 1975, right? Not any new studies beyond that. I'm sure they have conferences where they discuss those, but are the conferences sponsored by Big Pharma? We don't know. I would tend to think so, because Big Pharma is making a shit ton of money off of Americans. Well, yeah, Americans, because if you go over India or even Canada, it's more affordable, right? I just think we need to pay attention, because we're all being raped financially. Or the insurance companies are, then we have to pay higher insurance. Unless you have low income, then the government pays for it. Rant, rant, rant. I'm sorry, but we need to take personal responsibility for our health. I'm not a shining icon for that, because I do positive things, but I also do negative things, so don't look at me for a leader in all this. I don't have game in this equation, but I do have insight, and we all need to take personal responsibility for our health. So I think what am I at? 25 minutes. I'm sorry, but I give a high five to anybody that's hung out with me this long to hear this jazz. It's basically a rant, but it's based off some serious stuff. So I hope you get some value out of it. Pretty much with everything that I post, I hope you get some value out of it. And if you have any commentary you want to throw back at me, maybe you had a diagnosis from a physical from having your blood levels come back off, whether it's vitamin D, testosterone, estradiol, or cholesterol, or creatinine, all that stuff. I'm not a doctor. I'm not giving medical advice. I am giving insight to health, right? So just keep that clear, because I don't want to get sued or anything. But this is just a rant on what I've experienced with the knowledge that I have. I've studied nutrition since I was 19. I started lifting heavy at 18. Then I started looking at nutrition, and I have ever since. Fish oils, huge. Vitamin K, vitamin D, huge. Throwing in some quality, not the cheap, tasty stuff, but some quality protein. Not a bad idea. And fiber. I take Metamucil every morning, and I've been doing that not every morning, but I started doing that in my 30s. And then if you have some kombucha or something for your gut enzymes after that, then you're doing much better. Blah, blah, blah. I'm not a physical trainer, not a nutritionist, not a doctor. I just pay attention. And that's what we all need to do, okay? And hopefully this inspires you to do the same thing, especially if your markers come back from a physical and they're off, okay? Maybe set up another appointment with your doctor to go back and follow up. Don't just listen to me. I'm just, like I said, sharing insight and trying to open up some eyes. And that's all I've ever tried to do, open up eyes and generate conversations. So if this generates a conversation between you and your physician, awesome. I've done what I came here to do. All right. Talk to you guys later.